Welcome to the 2020-2021 training on proper COVID-19 office safety and etiquette. If we all do our part with social safety and etiquette, we and the school will ultimately be safe. In this training, we will cover proper hand washing, proper cough and sneeze etiquette, social distancing, including close contact interactions with students as part of your everyday job, as well as face coverings. Proper hand washing. Washing hands can keep you healthy and prevent the spread of infection from one person to the next. Germs can be spread from other people or surfaces when you touch your eyes, nose, and mouth with unwashed hands, prepare or eat food and drinks with unwashed hands, touch a contaminated surface or object, blow your nose, cough, or sneeze into your hands, and then touch another person's hands or common objects.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
Hand sanitizers. Sanitizers can quickly reduce the amount of germs on hands in many situations. However, sanitizers do not get rid of all types of germs. Hand sanitizers may not be as effective when hands are visibly dirty or greasy. Hand sanitizers might not remove harmful chemicals like pesticides and heavy metals from hands. Sanitizers should not be used as a substitute for hand washing. In the next video, we will review proper cough and sneeze etiquette.
Stop the spread of germs that can make you and others sick. Cover your nose and mouth with a tissue when you cough or sneeze. If you don't have a tissue, use your elbow. Wash hands often, especially after coughing or sneezing into a tissue.
Covering coughs and sneezes and keeping hands clean can help prevent the spread of serious respiratory illnesses like influenza, RSV, whooping cough, and COVID-19. Germs can easily spread by coughing, sneezing, or talking, touching your face with unwashed hands after touching contaminated surfaces or objects, touching surfaces or objects that may be frequently touched by another person. Remember to immediately wash your hands after blowing your nose, coughing, or sneezing. Washing your hands is one of the most effective ways to prevent yourself or your loved ones from getting sick, especially at key times when you are likely to get and spread germs. Social distancing. It is your personal responsibility to help stop the spread of germs by remaining at least 6 feet or 2 arms length from other people. What is social distancing? Social distancing is avoiding large gatherings in crowded areas. It means keeping at least a 6-foot distance between yourself and others. There are many safe things that you can do. Take a walk, play in the yard, family game nights, go for a drive to a non-crowded location, and even group video chats. Recommended strategies include increasing physical space between employees and customers, such as using drive-through services or partitions, implementing flexible meeting and travel options like postponing non-essential meetings or events. Deliver services remotely, such as using the phone, video, or web services. The risk of COVID-19 spread increases in school settings as this follows. A low risk. Students and teachers engage in virtual-only classes, activities, and events. More risk. Small, in-person classes. Groups of students stay together with the same teacher throughout the school day. Groups do not mix. Student remains 6 feet apart and they do not share objects. High risk. Full-sized in-person classes, activities, and events. Students are not spaced apart. They share classroom materials and supplies and mix between classes and activities. Maintain safe distance with students and with program spaces. Ensure 6 feet of distance between teachers and students and students and students. Bring in specialist staff such as art teachers, physical education teachers, music teachers to an individual classroom versus rotating all kids through a shared space that is not able to be cleaned in between each use. Whenever possible, hold physical education and music classes outside and encourage participants to spread out. Consider using visual cues to demonstrate physical spacing. Rearrange desks and common seating spaces to maximize the space between participants. Consider turning desks to face in the same direction rather than facing each other to reduce transmission caused from virus-containing droplets from talking, coughing, or sneezing. Consider using visual aids such as painter's tapes and stickers to illustrate traffic flow and appropriate spacing to support social distancing. Avoid community supplies when possible. If shared supplies are necessary, consider using designated bins for clean and used supplies. Community supplies are considered high touch and should be cleaned frequently. Do not share equipment between staff, volunteers, and participants where possible.
We ask a lot of you, and we are very grateful for all that you have done to slow and stop the spread of COVID-19 in the United States. Wearing a cloth face covering while in public is an important practice to slow the spread of the coronavirus. Evidence suggests that the virus can spread before people show symptoms, and from people who have the virus but never show symptoms. Me wearing a cloth face covering protects you, and you wearing a cloth face covering protects me. Many items you may have in your home can be used to create a face covering. Your cloth face covering should reach above your nose and below your chin, like this, to cover your mouth and nostrils. It should fit snugly against your face at the sides. Be made of multiple layers of fabric so you can still breathe through it, and be able to launder and machine dry without damaging the material or shape. And importantly, remember to keep the N95 mask available for healthcare workers and first responders. Thank you to the American people for all you've done to protect, especially those who are most vulnerable of COVID-19. We are a resilient nation, and we will emerge from this pandemic together stronger.
Thank you for attending this training. If you have questions or concerns, please feel free to contact your supervisor or the OHM BOCES Safety Office.